Ramogi, Siaya.
Kanyakla mar riwruok mar jochiw thieth owuok tung' mosuo kod kembe mag okumba mag thieth ma giwacho ni oketo yuto margi mbele gima rocho chenro mag thieth e pacho ka. Kotelnegi kod jagoro maduong' mar midhiero, jochiw thieth go ywago chal marach mar thieth e pacho ka mikelo kod achiedh nade mathoth masani koro okwako sekta no. Simbro Sokinda nigi ler mar wachni.
Kanyakla ma jochiw thieth koro wuok oko mar nyenyo fuok malach manitiere sekta mar thieth, gima giwacho ni mana kaka od thieth ma Nairobi, ure thieth mamoko bende kidek yudo achiedh nade maket gimago. Giduol achiel, jochiw thieth go ochudho kembe mag okumba mag thieth, ma giwacho ni oketo yuto margi nyime gima rocho rang'iny mar thieth ma jotuo yudo.
When insurance companies cannot engage with the institutions, they cannot engage in the quality of care that is needed, but they focus on the profits, that's what we see. And that this goes to all of them, because what will unite AR and Jubilee and Britam and First Assurance? It is the profit making. So this is our call, that insurance companies should make it possible for healthcare workers to do their job. They should make it easier for patients to access care.
Kotelne ko jagoro maduong' mar KMPDU jochiw thieth go ywak ni kembe mag okumba ema sani okawo ting' mar chiko jotuo kako nego thiedhgi.
The moment they dictate the doctor who ought to see you, that if it is not Dr. Jared, then you can't be treated in an hospital. If it is the moment they dictate the drugs that you need to have, or even the test, then they actually perpetrate, they ensure the quality of care you can't have. They're actually acting to maximize the profits in the name of trying to say that they are approving care.
Komachielo jochiw thieth gi bende dwaro mondo migawo mar thieth oruch chenro mar ndiko jochiw thieth e bwo UHC ma giwacho ni oselewo kata obedo ni budget margi noseketi chon.
Ministry of Health did not ask for that money. It is us, the unions and the UHC workers, who went on the streets and ensured that a budget is allocated of 606.2 billion to absorb UHC workers into permanent and pensionable terms. Today, as we speak, the process has delayed with 2 months.
We were told that they needed to do verification. The head count was done, and I think several weeks ago. But we are not getting any clear way forward on when these health workers are going to be absorbed. Now we are heading into September. Our expectation is that by 1st of September, the UHC staff should have been confirmed and backdated to 1st of July.
Kamano bende giseo 10 counties moko e wileo mar chulo sara gima omiyo moko kuom counties go nyaka sani onge thieth madhiyo e nyime e wi ng'anyo mar jochiw thieth.
Some of them have gone rogue, and have gone rogue to a greater extent. We have, as we talk today, 83 days for the doctors' strike in Kiambu County. It means that the people of Kiambu County, despite paying taxes, despite electing MCAs and the MPs and the elected leaders, including the governors, they have no care for the last 3 months.
Jochiw thieth gisingo mar bago ng'anyo mar atipo e thuolo mar ndalo 7 mabiro, poni jochiw thieth ok ochulo sachgi mar dweche 2 mokalo.